Hi, everybody. I think I'm live and I'm trying to be super technical and be on Instagram and Facebook at the same time. Woohoo! Okay, so today I'm going to wait for a few more people to join here. But today I'm going to do a little quick intro on liposuction. So, liposuction is one of the most common procedures performed in terms of aesthetic plastic surgery. So, liposuction is a procedure to reduce unwanted pockets or areas of fat and to contour certain areas, or think of it almost like sculpting certain areas. Um, it is still a surgery or a procedure, but it is typically done with small access incisions. So usually those access incisions are less than a centimeter. And we use cannulas to do certain things like place numbing medicine called tumescent fluid. So tumescent fluid is a combination of medications mixed in fluid that has numbing medicine as well as medicine that constricts blood vessels so you don't bleed or bruise as much. And then we add other things as well, sometimes to make it hurt a little less going in, sometimes to, again, further decrease bleeding or bruising. So we then put that in, and then we can do a couple of other steps. The main step is a cannula that goes in to suction the fat out or contour the fat. There's a couple of steps we often add in before that. One might be adding heat and or ultrasound technology to kind of break up fat or break up scar tissue if it's a revision case. Another thing that we do, which I do a lot more frequently, is we use a cannula that kind of has a larger tip on it that I use to kind of separate the fat. So that is an acronym called SAFE Lipo that was kind of invented and perfected by my good friend Simeon Wall. SAFE stands for separation. So we use that, what we call a basket tip cannula or exploded tip cannula, to separate kind of the skin layer from the deeper fat layer and break things up. Then aspiration is the A, and that's the suctioning of the fat, removing the volume, removing fat cells. And then fat equalization is the FE, where we go back to that basket tip cannula to kind of equalize and kind of smooth things out. So those steps are actually optional. The two main steps that are in any type of liposuction are the tumescent fluid and then the aspiration or suctioning the fat out. So somebody is asking where we see the best results and who's the best candidate. So that's a great question. The best candidate, and therefore we get the best results, are patients, men or women, who have pretty close to their ideal body weight. They're not overweight or dramatically underweight. They're pretty close to their ideal weight, and they have certain areas that are stubborn or problematic areas. Liposuction can be used head to toe. The common areas would be in terms of the just starting head to toe, the neck area, the back, mid back, love handle area or flank area, the abdomen, inner and outer thighs, anterior thighs, around the knees. Those are all common areas for liposuction. And again, people don't lose weight from liposuction. It's a contouring procedure. So if you've got an extra pocket of fat in an area, we can go in and sculpt that area with liposuction. Typically, you're not going to lose any weight on the bathroom scale, but you may look like you've lost weight because the contour is improved. Best candidates, again, ideal weight, pocket or pockets that are a bit bothersome, and then really good skin quality. So, for example, if somebody has extra skin, liposuction is generally not going to tighten up that skin too much. So, a great example of this might be somebody who's thinking, am I a candidate for a tummy tuck versus liposuction of my abdomen? Or I know I want my abdominal area to look better. I wonder what is a better option for me. So liposuction alone generally works best for the abdominal area. Somebody who really doesn't have a lot of skin excess. They have good, thick skin quality, and it's just more some extra fat in that area that we can go in and smooth. The fat in between your muscles, if you tighten your muscle, and your skin. It doesn't work for people who have what we call intra-abdominal fat or fat inside, like around organs and things like that. We're not going to touch that with liposuction, and really the only way to get rid of that is to lose weight. Um, if somebody has loose skin on their abdomen, say after losing weight or after having pregnancies and that skin gets stretched out and doesn't quite bounce back, then typically they're going to be a better candidate for a tummy tuck or an abdominoplasty. An abdominoplasty is often combined with liposuction, but usually to address that extra on the abdomen, tummy tuck's going to be better. A couple other questions that came through. So, is liposuction combined with other surgeries? Yes. It's actually, in my practice, I would say it's unusual that I'm doing just liposuction on somebody. In most cosmetic cases that I do, I would say liposuction is an adjunct to something else I'm doing. So I mentioned tummy tuck. It's very common to do liposuction of, say, the back and the waist and kind of that love handle area along with a tummy tuck to kind of contour the whole trunk or the whole waist. That's very common. Neck lift patients or facelift patients, it's very common to do a bit of liposuction in the neck as well. Topic for another day, but we often will use that fat and graft it somewhere else. Again, contouring, repositioning, things like that. Somebody else asked about cellulite. Does liposuction treat cellulite? In general, it's not a treatment for cellulite. Cellulite is a really tricky problem, and everybody's cellulite is a little different. So the classic definition of cellulite is a dimple, which is basically a piece of connective tissue that goes from the skin to the deeper connective tissue that travels through that fat that lives in between your skin and that connective tissue, and it puckers or pulls in the skin in that area, giving you a dimple. So one treatment is to release that tether to pop that out. But other people actually have kind of some laxity to their skin, and that can give kind of a wavy appearance to the skin that some people think looks like cellulite. And actually trying to release those bands isn't really going to fix it because the skin is still loose. Sometimes with that safe liposuction technique I described earlier, that SAFE, safe lipo, sometimes with that we can get a little bit of smoothing of the appearance of cellulite, but I never tell a patient to expect that. If that's the primary reason they're wanting liposuction, then I'm pretty hesitant to offer that because I'm concerned they may not be happy with that. Some other great questions about liposuction are, can it be done awake or does it always have to be done in the operating room? So in general, I would say that depends on a few things. It depends on kind of the amount of liposuction you're planning to do, kind of the volume or the number of areas. And that has to do with your safety in terms of, maybe needing IV fluids, maybe needing to be monitored more closely, but also being able to make you comfortable for the procedure and not giving you more numbing medicine than is safe. And so sometimes we'll want to do that in the operating room. The other factors with awake in the office, for example, versus in the operating room have to do with surgeon preference. I can be very honest and tell you that I prefer to do it in the operating room. I think it's a more controlled setting. I think I can do a better job for my patients. So sometimes it has to do with patient preference. But if it's a small area, then definitely in the office can make a lot of sense. Other questions that came in, all of these are great questions. Other questions that came in were in regard to recovery and downtime. Recovery and downtime with liposuction in general is very manageable. Usually patients can go home the same day after surgery, so it's outpatient surgery. And then recovery, I tell people usually as the numbing medicine starts to wear off, in the area that was suctioned, you'll start to feel kind of a stinging and burning in the skin, which is typically manageable, but it can be a bit uncomfortable. And then it transitions to a sore feeling. A lot of people will describe, depending on the area, that it almost feels like a really tough workout in that area, that they feel quite sore. Again, if somebody has liposuction of a real tiny area, that might really be no big deal. Somebody else who might have quite a bit of liposuction of multiple areas at the same time, they're going to be a bit more sore, and their downtime is going to be a bit longer. Most people want to take maybe a day or two off of work, and then after that, generally you can go back to work. Again, you might be a little sore, you might be moving a little bit more slowly, but in general, depending on the type of work you do, getting back to work. Nowadays, with so many people working virtually, often you can go back to work the next day if you want to. I tell my patients there's really nothing dangerous about being on a laptop at home after surgery, but you may be a little tired, a little sore, and so you may not want to work a full day, for example. But certainly after a few days, most people are, oh, hi. Most people are very comfortable to go back to work after that. Let's see. What other questions am I forgetting? In general, I would say you want to seek out a board certified plastic surgeon. You guys are probably very sick of hearing me say that, but I think it's really important. This shouldn't be done by somebody who's not trained in all techniques of aesthetic surgery for a few reasons. The most important is your safety. You want to make sure that your surgeon is trained to take care of you should a complication arise. So safety is really important. But also you want to make sure that your surgeon has all of the tools at their fingertips. So as I mentioned before, that question about should I have a tummy tuck or liposuction, or, can I do liposuction of my neck, or do I need a neck lift? Those kinds of questions. You don't want to really ask somebody who only does liposuction whether or not you should do a tummy tuck or liposuction, because guess what? They're probably going to say, yeah, let's do liposuction, when maybe what was better for you was a tummy tuck or an abdominoplasty. And so seeking out a surgeon who really does all of those things, I think your evaluation and the recommendations that are given to you are likely going to be a bit more accurate. So in general, I would say if liposuction is something you are considering, make sure that you are evaluated by a board certified plastic surgeon who does body contouring, and can evaluate you and tell you what they think. I do definitely see patients occasionally who I feel could kind of benefit maybe from more than one thing, and we'll talk about the pros and the cons to each approach. And so everybody can make a really informed decision. But in general, liposuction is a super powerful tool that as a surgeon, I have to use alone and commonly in conjunction with other procedures that, again, really just can help contour, improve shape, not weight loss, but contour and improve shape. And so the best candidates, to recap, somebody who's healthy, otherwise in good medical shape, in good physical condition, close to ideal body weight, and has some areas of fat that they want to have addressed with contouring. Those are the ideal candidates. I hope this was helpful. I'll be doing, as you know, we do these videos on Facebook, and I'm going to continue to put them on Instagram as well, because I think that is helpful for you guys. So any other questions, don't hesitate to DM me or leave some comments, and I'd be happy to answer them. And I hope everybody has a lovely rest of your day. I'm going to get back to my clinic, seeing patients the rest of the day, and I look forward to seeing you all soon.